Today, we delve into a dark chapter of history, shedding light on the unimaginable hardships faced by enslaved pregnant women during the era of slave breeding. While we often hear about the agonizing separations of enslaved mothers from their infants, the equally distressing experiences of these women during pregnancy and childbirth have often been overlooked. Imagine this scene: a pregnant black woman working tirelessly on a vast plantation, surrounded by her fellow enslaved people. You might assume that her masters would offer her some respite, especially if it's her first pregnancy, ensuring both her and her baby's well-being. Unfortunately, the truth is much harsher. Pregnant enslaved women endured the same backbreaking labor and harsh treatment as any other enslaved person on the plantation. Shockingly, they were often expected to return to work within days, even if they managed to survive the ordeal of childbirth. And this is just the beginning of the challenges they faced. The practice of breeding enslaved people and treating them like livestock wasn't a new concept. It was a deliberate and systematic approach aimed at increasing the number of enslaved individuals, consequently boosting the wealth of slave owners. Let's rewind to the early 1600s when the transatlantic slave trade began. In 1619, the first enslaved Africans arrived in Jamestown, Virginia. Back then, slavery wasn't solely based on one's race. It primarily depended on being captured and forced into slavery. However, this soon evolved as slavery proved to be highly profitable. Laws were established to ensure that enslaved Africans remained in bondage for life, and this status could be inherited across generations. Essentially, these individuals were viewed as property and were treated accordingly. They were bought and sold without any legal rights. During the 1800s, the practice of slave breeding became a profitable and disturbing business in the United States. Breeding farms and houses were established across the country to facilitate this inhumane practice. One notable example was in Virginia, where a man named Thomas Jefferson, often revered as a founding father, owned a breeding farm. Despite his famous words about equality, Jefferson owned over 600 slaves, many of whom he used as breeding stock. Unfortunately, this practice wasn't limited to Jefferson alone. It was widespread among many slave owners who viewed enslaved women as mere property, stripped of their humanity. These women were subjected to unimaginable emotional trauma as their children were forcibly taken from them at birth and sold like commodities. One of the most notorious breeding farms was known as the Weeping Time in Savannah, Georgia, owned by Pierce Mies Butler, a wealthy plantation owner and, shockingly, one of the founding fathers of the United States. The conditions in these breeding farms and houses were deplorable, with women living in cramped, poorly ventilated quarters and receiving barely enough food to survive. Their medical needs were ignored, and pregnant women were forced to work in the fields until the day they gave birth. Even after giving birth, their babies were taken away and sold while the women were compelled to continue working. These enslaved women were denied the basic rights of motherhood and caring for their own children. One poignant example is Harriet Jacobs, an enslaved woman in North Carolina. Harriet's story is a heart-wrenching example of the suffering endured by enslaved women in the United States. She was forced into a sexual relationship with her owner, which led to her pregnancy. The owner's wife, consumed by jealousy, mistreated her. Harriet knew her child would be taken from her, so she made the painful decision to escape and hide in a small attic space in her grandmother's house for 7 long years. During this time, she watched her children grow up without her presence. Harriet's story is just one among many that shed light on the harrowing experiences of enslaved women. Enslaved women faced a double injustice. They were not only compelled to have sexual relations with men specifically chosen to produce desirable offspring, but they were also denied the fundamental right to care for their own children. The horrors they endured did not stop there. Enslaved women were subjected to cruel and perilous birthing practices that often resulted in injury, infection, and even death. They were frequently forced to give birth on the plantation floor without any medical assistance or pain relief. Some were subjected to barbaric procedures like pelvic breaking, intended to widen the birth canal and ease delivery. However, this procedure was performed without anesthesia, resulting in severe pain, trauma, and long-term physical disabilities as large instruments were forcibly used to separate the pelvic bones. Another distressing method employed during childbirth for enslaved women was the use of a birthing chair. This chair featured straps or ropes to secure the woman's legs apart and a hole in the seat, allowing the baby to be delivered directly onto the ground. While this design made it easier for slave owners or midwives to catch the baby, it also made it incredibly challenging for the woman to move or control her body during labor. Enslaved women often had to endure these and other cruel birthing practices without their consent or a clear understanding of what was happening to them. Compounding this tragedy is the fact that historical documentation on these practices is scarce, as the media of the time often sought to conceal this dark chapter of history. Enslaved women were typically denied access to education, forbidden from reading or writing, and silenced by those in power. Consequently, they couldn't effectively oppose or document these barbaric practices. Nonetheless, there are some accounts and records that shed light on these atrocities. One such account comes from Harriet Jacobs, an enslaved woman who managed to escape from slavery in North Carolina in 1842. In her autobiography, Incidents in the Life of a Slave Girl, Jacobs vividly describes the use of the birthing chair and its role in restraining and subduing enslaved women during childbirth. She also recounts the trauma and physical harm inflicted by the practice of pelvic breaking, which she witnessed firsthand. Another disturbing account emerges from the practices of a physician named James Marion Sims, who conducted gruesome experiments and surgeries on enslaved women. It's important to note that these practices were not confined to the United States, but also occurred in other regions worldwide where slavery prevailed, including the Caribbean and South America. Instances of the birthing chair's use in Jamaica and the pelvis breaking procedure in Brazil have been documented. The trauma experienced by pregnant women on slave breeding farms extended far beyond childbirth. These women were also subjected to unimaginable horrors, becoming subjects for medical experiments and surgeries. Physicians used them for experiments involving new surgical procedures, drug testing, medication trials, and medical research, often treating them as guinea pigs. Dr. James Marion Sims, renowned for his contributions to modern gynecology, conducted these experiments on enslaved black women without their consent or anesthesia. Sims held the disturbing belief that black women did not perceive pain similarly to white women, justifying his omission of anesthesia during surgeries. Sims conducted numerous experiments and surgeries on enslaved women, sometimes performing up to 30 surgeries on a single individual. Many of these procedures aim to treat conditions like vesicovaginal fistulas, a childbirth complication leading to incontinence. One of his patients, Anarcha, suffered from this condition for years, which is caused by prolonged and obstructed labor, resulting in a hole between the bladder and vagina. During these surgeries, Sims employed whatever tools were available, including a shoemaker's awl and a borrowed silver spoon from his wife. Enslaved women who eventually bore children had no control over their infants' lives. These babies were not considered their own, but rather the property of their white masters. As a result, these children were often separated from their mothers shortly after weaning, sometimes as early as 6 weeks old, and sold to other slave owners. They were viewed as commodities, subject to the whims of their owners. The conditions under which these children were raised were harrowing, as they were forced into labor from a very young age, enduring grueling tasks in fields or their masters' homes. They had no rights, no freedoms, and no prospects for a better life. As they were born into slavery, their destinies sealed from their first breath. A profoundly disturbing example of this practice unfolded in Louisiana during the mid-1800s, revolving around plantation owner James H. Whitaker. Whitaker, who possessed more than 300 slaves, earned a reputation for his exceptionally cruel treatment of them. He was notorious for promptly selling the offspring of enslaved women once they were weaned. Shockingly, Whitaker maintained a nursery on his plantation where these infants were kept until they reached an age suitable for sale. The conditions within this nursery were nothing short of appalling. The babies endured squalid, cramped quarters and often suffered from sickness and malnutrition. Upon being sold, these infants were forever separated from their mothers, never to be reunited. However, it's crucial to recognize that Whitaker wasn't the only one engaging in this horrific practice, It was a distressingly common occurrence throughout the American South and persisted throughout the entire era of slavery in the United States. Enslaved mothers were subjected to the heart-wrenching ordeal of witnessing their children forcibly torn away from them, their familial bonds shattered. This practice was so ingrained in the culture that it was even codified into law in certain states. For instance, in Virginia, a law enacted in 1662 declared that a child's status was determined by its mother's status. This meant that even if a child's father was a free man, if its mother was a slave, the child would be born into slavery. This law remained in effect until the abolition of slavery in the United States, perpetuating the systematic separation of families and the sale of children soon after they were weaned. In Virginia alone, it's estimated that over 400,000 children were born to enslaved women, many of whom were tragically sold off to other slave owners, permanently separated from their families. As we reflect on this dark chapter in our history, we must acknowledge that the legacy of slavery continues to cast its shadow today. It's imperative that we recognize and address the ongoing racism and inequality that affect the lives of Black women. To build a more equitable future, we must remember these stories and commit ourselves to preventing such atrocities from ever happening again. Let us draw lessons from the past to forge a better future, one where the mistreatment of any human being is no longer tolerated. Well, that's all it for today. If you found this video informative, don't forget to hit the thumbs up and subscribe to stay engaged with more fascinating stories from around the world.